So he's in extension, so we're going to adjust it back into flexion and hopefully take out some of that extension restriction.
I got you.
Perfect. Excellent. Perfect. Awesome. All right, I got John in the office today. He works in the oil and gas field. He's a hard worker. He goes away for weeks at a time, comes back, so he's here for his regular adjustment. Anything bothering you today, or is it?
Yeah, my lower back like
low
normal.
back there? Okay. All right, go face down for me. So low back, but I'm gonna adjust him full spine. We're gonna do is we do what? Elbows, wrists, knees. Yep. So we do a little extra work on him, some stretching. So it's a good. I thought it'd be a good video to do, and let's get to it. You all ready for Christmas? Oh,
I'm getting there. House is all decorated. Still gotta do some shopping.
Get the lights up. Yeah. I went to look for more, and they're sold. Can't find them anywhere.
Oh, I've been buying them early, so he's been home.
Yeah. Yes, exactly. That's probably what it is. Yep. All right. So just some soft tissue on his low back. We do this for all the patients. You know, I'm targeted to where the your problems are. For in his case, he's got a lot of like swelling build up down here, so we're trying to flush out some of the inflammation in his low back. It's going to help him feel looser and just give him better range of motion. It's going to help his adjustment hold better. He's got some pelvic unleveling. I have to do this all the time, but his right leg is short, so his pelvis is rotated on his right side. This SI joint's rotated in extension. That's pulling his femur up. It's making this leg look short. Long story short, basically, no pun intended, is that his hips are out of alignment there. I heard you didn't know that. So we use a lot of drop table work in the office. And that's where we set the drop, contact his SI. So he's in extension, so we're going to adjust it back into flexion and hopefully take out some of that extension restriction and get his legs to even out a little bit. It's obviously very loud, sounds very loud, but it's very comfortable for the patient. So for anybody who doesn't like to be twisted, especially that side posture, low back adjustment, we can adjust your low back and hips and sacrum and pelvis without having to twist and get all that cracking. Take a deep breath in, John. Exhale all the way out. Perfect. One more. That's it. Slide down towards your feet. Good, 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 good. Just hold a little traction then. I'm gonna get with my elbow and forearm right on his right QL. Just kind of hold a little pressure. Now I'm into his right piriformis. You okay there?
Yep.
All right, now I'm gonna have you go on your side facing me. I'll do more soft tissue. Lift that up for me. All right, so we're gonna adjust his low back. Take a deep breath in, John. Blow it all the way out. I got you. Perfect. Other side. Exhale all the way out. Excellent. Face up. Hang on to the table, just to the side there. Just a little adjustment in his hips here. And this one, same thing, just relaxing. And then, you okay there? Yep. Okay, very good. So for some patients, we'll also stretch, do a little manual stretching. So this is just a good low back sciatic stretch. So it's one I recommend people do a lot at home too. You can kind of take your leg into a figure four. This is stretching the glute, his low back. Then we'll come straight and we'll actually bring it over to the other side. This is getting more of his piriformis, his low back QL muscle here. So if you're at home, just with a towel or a stretch band, or you can reach up and use your own hand, you can kind of pull your knee to your chest, do 30 seconds facing, same knee, same shoulder, then maybe do 30 seconds bringing that knee towards the other shoulder, keeping it tight to your chest the whole time. And then maybe do 30 seconds in a figure four. You can even bring this leg up, John. Knee it up. So you can kind of let it sit there like that. You can pull, just kind of grab onto your foot and pull it down, or you can bring your whole leg up, kind of like that, A little bit, there you go. You okay?
Yeah.
So I tell people, especially with low back, the two things you can do at home without, obviously come see us, but if your low back's tight, if you're having sciatic pain, ice and stretch at home. This is probably the stretches I would start with. I would lay on your back on a nice hard surface and just kind of pull your knee to your chest. And I'd go over, just like we just did with his right leg. You ever feel a stretch there?
Oh, yeah.
We do 30, seconds or a minute each way in the office, but at home you can kind of do this a couple different times. Bring this knee up. You okay? It's not necessarily his low back that we're stretching, it's more of like the pelvis and legs, but that's where you get your strength and your base from. The more flexible and pliable your hips and legs are, the less stress goes on your low back. If you're tight through your hips, all that gets translated to your low back, and that's how you end up with disc problems and a bad low back. So to the extent that you can stretch, even just doing hamstrings, to the extent that you can stretch your legs, the better off your low back's gonna be. Okay? This one more time. That's it. All right, let's get your neck adjusted, and then we'll get you up. All right, stand up. Perfect. Same thing, just relax your shoulder. Awesome, and we'll do one of this mid-back. Look, the hat stayed on and everything. Deep breath. Exhale. Good. One more. We got that pretty good already. He's moving good. Shoulders, wrists, knees.
Yep.
Come on up. Got a big night ahead of you. Cross these arms for me. Let that arm drop. Same thing, let this arm relax. That's the glenohumeral shoulder joint adjustment. Everybody's so far rounded at a desk, at a computer. No matter what your job is, and most things, our hands and our arms are out in front of us. So that shoulder adjustment helps keep things back. Now I'm gonna do his wrists and elbows. You have 8 carpal bones in your wrists. 4 and 4, and they form your carpal tunnel. But slide back a little bit, lean back, there you go. Keep going back like you're gonna go off the table. Good. Just relax your arm. Those carpal bones can be adjusted to prevent, let's say, carpal tunnel, or to help carpal tunnel, or just if your wrists bother you or tight. You're doing a lot with your hands, right?
Oh, wait, no.
Work, and he's
Constantly.
just relax your elbow. Good on this one. Good. Okay. So I can feel, you might not be able to hear that in the video, but I can hear underneath my hands his carpal bones moving a little bit. And that's a good thing. We're kind of moving those back into place, slide back a little bit. There you go. Good, relax your elbow. Knees?
Sure.
Swing your feet this way for me. Come to the side a little bit. So for the knees, we do a couple different things. The long axis distraction was a little bit of a knee. Mainly it was his hip and ankle. But we do this mobilization, which is like a meniscal release, but it's really just good for just generalized knee pain and sort of just relax your leg. So I kind of contact different areas. I got my outside arm pushing medial, and we're just kind of moving the knee around a little bit, motioning it, sort of mobilizing it. It's good for, like I said, just general knee pain and soreness. And if there's a little restriction there, I can adjust it. That one felt pretty good. Just relax that knee. Very good. Anything else right now?
Nope. All good to go.
All right, that's his full spine adjustment for Santa. And we're going to be good to go. We'll see you next time. Thanks.